Hello friends, welcome to TechQuest channel. This is for the medical laboratory technologist by EarTech. In this video, we will discuss about phlebotomy procedures, how to get a good sample. Predominant pre-analytical errors comes from sample collection, transport and storage of sample. Assemble equipments, arrange all necessary items for phlebotomy procedure. Storage of test tubes or anticoagulated tubes cause delay in collection. If timed sample collection, the sample may be delayed, that can give erroneous reports. Patient comfort. First, introduce yourself and make the patient comfortable and ask whether the patient has allergies, phobias, or has ever had fainted during previous injections or blood draw. If the patient is anxious or afraid, reassure the person and ask what would make them more comfortable. Make the patient comfortable in supine position if possible. Discuss the test to be performed and obtain verbal consent. Patient has the rights to refuse the sample collection. Identification of patient. Where the patient is adult and conscious, ask the patient to state their full name and the date of birth. Check that the laboratory form matches the patient's identity. Check for dialysis shunt, lymphedema, or any arm precautions before identifying the vein. For pediatric and neonatal patients, use the wristband or footband only if it is attached to the patient. Do not use the bed number or a wristband that is attached to the bed or the cot. If a parent or guardian is present, ask that person for child's first name and last name, date of birth and hospital or the file number. Select the site. Locate the vein of a good size that is visible, straight and clear. The vein should be visible without applying the tourniquet. Locating the vein will help in determining the correct size of needle. Tourniquet application. Apply the tourniquet about 4 to 5 finger width above the venipuncture site and re-examine the vein. Ideally, use a disposable tourniquet for each patient. If not possible, regular disinfection of tourniquet is required as tourniquet can transmit infections between patients. Perform hand hygiene and put the glove. Wash hands, soap and water and dry with a single-use towels, or if the hands are not visibly contaminated, clean with alcohol rub. Use 3 ml of alcohol rub on the palm of the hand and rub it into fingertips, back of the hand and all over the hand until it dries. After performing hand hygiene, put on well-fitting, non-sterile glove. Disinfect the entry site unless drawing the blood culture or preparing for blood collection. Clean the site with 70% alcohol swab for 30 seconds and allow it to dry completely. It takes around 30 seconds. Alcohol can cause hemolysis if the alcohol is not allowed to dry completely at collection site. Apply alcohol swab. Apply firm but gentle pressure. Start from the center of the venipuncture site and work downwards and outwards to cover an area of 2 cm or more. Or swab from the center to outwards in circular manner. Do not touch the clean area. If it becomes unsterile, if it is touched, repeat the disinfection procedure. Arrange the collection tubes. Arrange the required collection tubes before making venipuncture. Do not search for the tube that makes delay in collection and clots may be formed. Use appropriate anticoagulated tubes. Blue top tubes are available for 2 ml, 3 ml and 5 ml. Do not use 5 ml tube for pediatric or neonates as they can increase the vacuum for small veins and cause hemolysis. Order of draw. Follow the order of draw to avoid contamination of sample between collection tubes. Please watch my video on order of draw in the same channel. Release of tourniquet. Once sufficient blood is drawn, release the tourniquet before withdrawing the needle. Withdraw the needle gently and apply gentle pressure to the site with a clean gauze or dry cotton wool ball. Ask the patient to hold the gauze or cotton wool in place with the arm extended and raised. Ask the patient not to bend the arm. This causes hematoma. If patient on anticoagulant therapy, apply extra pressure. If a syringe or wing needle set is used, place the tube into the rack before filling the tube. To prevent needle sticks, use one hand to fill the tube. If vacuum tubes are used, do not press the syringe plunger as this can increase the pressure along with the vacuum and cause hemolysis. Do not recap the needle as this can lead to needle stick. Discard the used needle and syringe or blood sampling device into a puncture resistant Sharps container. Label the tubes and check the label and the forms for accuracy. The label should be clearly written with the information required by the lab. Inform the patient when the procedure is over. Ask the patient how they are feeling. Check the insertion site to verify that it is not bleeding. Then thank the patient. Clean up spills of blood. If blood spillage has occurred because of a laboratory sample breaking in the phlebotomy area or during transportation or excessive bleeding during the procedure, clean it with paper towel, wearing gloves and apron. Clean it with disinfectant and allow it to dry before the next patient collection is done. Mixing of tubes. Invert the tubes containing additives for the required number of times as specified by the lab. Vigorous mixing can lead to sample hemolysis. Severe adverse events with phlebotomy are very rare but may include loss of consciousness with seizures. Less severe events include pain at the site of venipuncture, anxiety, and fainting. Phlebotomy personnel may occasionally be accidentally exposed to blood and other body fluids that are potentially infected with HIV, hepatitis virus, or other bloodborne pathogens. Post-exposure prophylaxis can help to prevent the transmission of pathogens after a potential exposure. Thanks for watching. Please like, share, and comment. Thank you.